Let's take a look at how technology needs to slip into the background to allow medical professionals to provide quality care to their patients. I'm Brian Westbrook. Coming up, we'll take a look at remote collaboration and consultation with specialists. We'll also look at power apps on the Surface Duo, and we'll chat with Clifford Goldsmith, Chief Medical Officer for Microsoft US. How has the current climate changed the demand for telemedicine, the demand for telehealth, and what products and services are helping bridge that gap?
Before the pandemic, virtual visits were already something that was available in the industry. People used it. Suddenly, with the pandemic, because people were now socially distanced, had to isolate, were anxious about getting out, virtual visits became imperative almost. And we saw a rise. I think the figures I've seen from American Telehealth Association is about 14% of visits became telehealth visits or virtual visits. And the product that Microsoft has that supports televisits is our Teams product, which allows us to really communicate effectively with patients or with other clinicians in a consultation environment. What's not happened up until now is we haven't moved from virtual visits where we are today into what we're all calling virtual health, which really requires adding more information to that environment in order to be able to continually care for that patient wherever they are. And so very excited to be here with this Duo because I actually begin to see the potential for this device in its size that it is to easily go into a pocket of a jacket like this or into a pocket of a white coat that you can walk around with. It also connects as my phone, but what I really like about it is it has more real estate on the screen.
One of the big challenges right now is really real estate. It's difficult to really see a lot of what you need to see to do your job in medicine when you just have 6 inches of space. But if you can have double that, if you have the ability to see multiple views, I think it makes it much easier to actually have a device in a hospital setting.
I so often find myself talking to somebody and wanting to see something else. And not able to do that on a phone very easily. And you lose the screen and you have to find it again. But being able to look at them together and talk to the person about whatever it is you're looking at, whether it's evidence-based guidelines and saying, this is how I would approach this case, or whether it's looking at the data here and saying, oh, this patient has a low hemoglobin, or whether it's simply looking at the electronic health record in general of things, or an image could be something else that you'd have on the side here. You could have an X-ray, you could have an ECG.
Let's talk a little bit about how we can use Microsoft devices to enable hybrid scenarios of care. One example of this might be, I'm playing a role of a nurse, and as a nurse, I might come to your house, and let's say you have a finger fracture. I'll look at the finger fracture, and maybe not being sure if it's broken, I might want to connect with a primary care physician who isn't here. Using my HoloLens, I can connect to the physician, who happens to be on call, while the physician on a Surface Duo would be able to see everything that I can see on one screen while seeing the patient's record on the other screen. The physician will be able to see in 3D everything that I'm seeing and everything that I've mocked up as well.
And the key of the Surface Duo here is that it's ultimately portable. They can have this in their pocket, they can take it on the go with them, they don't have to worry about lugging around an old laptop with a noisy fan. They have that sleek portable device that can be their phone every day, keep them in touch with the world, but also be able to take telehealth, telemedicine visits. What do you see, just more generally speaking, the Surface family offering to healthcare?
What I really like is there's a consistent feel. It's very easy to move from one device to another. And for me, that's been, that's something that's important because physicians don't want to learn technology. They want technology to work for them. And they don't have a lot of time to waste on learning that either. And so if you've got devices that are getting better and better at their specialized functions, like this device is versus a hub, which is obviously highly specialized for working together with other people. In addition to the common interface, which makes it very productive across different devices, is the ability of the Surface to provide the security and privacy that healthcare needs.
There are all kinds of places where you're going to see Surface devices. Everything from the back office, where you can have really powerful Surface books actually helping to run everything from revenue cycle management to population health. You can see the Hub 2 now in the back office as well. So you can have huge dashboards to do everything from triaging to intake to pop health that you can then use to create various types of outreach campaigns to patients. And then things like Duo, of course.
I'm excited about Surface because I think it's, first of all, it's a enterprise device in a sense. It's a clinical device. It's got all of the features that allow you to connect securely to your hospital information system. And many of those hospital information systems have been designed for Windows-based devices already, very well designed for Windows devices. So the Surface is actually a device that seems to work particularly well for physicians or nurses connecting to their hospital system when they're mobile.
I think it's really going to be up to the healthcare organizations who use it. We're really excited to hear the feedback. You're going to see more care coordination that takes place. You're going to see more patient engagement that'll take place. I think as more hospitals start using it, we start seeing additional use cases, I'm really excited to see the innovative ways that healthcare providers are going to start weaving this into their overall continuum of care.
What a journey. We've looked at how Surface devices such as Surface Duo, Surface Hub 2S, and others are bringing patients and providers even closer together. We've looked toward the future of telemedicine and telehealth, and we're looking forward to what's to come. Thanks for watching and stay safe.